You injured your spine in an auto accident, or maybe you injured it doing something at work. Regardless of how you've injured it, now you're in pain. Most likely, you will have sprained your spine, which is an injury to your spinal ligaments. Whether you realize it or not, if the pain persists beyond a couple of days and you don't find the right doctor to take care of you, your life could take a turn for the worse starting now. You see, spinal ligament injuries can cause you to have permanent pain and instability, pain that can reduce your ability to do and enjoy the many activities that make life fun. So who is the right doctor to see, and how will I know what to look for? The doctor that specializes in treating these injuries or the chronic pain that comes from them knows that spinal ligament injuries cause abnormal or excessive joint play. These doctors know the more joint play there is, the more injury there is, and they're going to want to know where is it and how bad is it in your spine. These doctors take flexion extension x-rays or motion x-rays of your spine and send them out to have a specialized medical radiologist perform a procedure that accurately measures the spine for abnormal motion. With this information, they can now set up an appropriate treatment plan to reduce or alleviate the problem altogether and keep you away from the procedures that you may want to avoid. Look, when the spine's in motion, there should be very little joint play associated with that motion. So we see here a very minimal amount of joint play in the spine, and we can tell exactly where it is. So can the doctor. Where is it? It's mostly at C3 and C4, but it's minimal. Any combined pattern that's not over 1 millimeter of joint play is not considered excessive, and this is considered to be more mild sprain findings. Now, here we actually start to see more excessive movement. But where is the movement? It's very easy to tell. Anybody can see from this study, from the CRMA study, where is the excessive joint motion? Well, it's at C5 and C6. Here, we see excessive joint motion that's now crossing over beyond 3.5 millimeters of translation, and now we're starting to see more severe, more excessive joint motion. But again, the doctor can tell exactly where this problem is. How about this one? Well, this patient actually has a lot of excessive motion when they're flexing their spine or bending it forward. And when doing combined motions, the most excessive motion is actually in the upper cervical spine. How about this one? Well, it's the upper cervical spine. So it's very easy from these reads, from these CRMA reports, to be able to determine where and how bad the ligament damage is. This patient has excessive joint play or excessive ligament damage is indicated throughout the whole cervical spine. Now, this testing procedure is just as beneficial for those people who have low back problems or the lumbar spine as it is for the cervical spine. The enjoyment that you get out of the many activities of your life may be at stake by choosing the wrong doctor. If your doctor cannot tell you how to determine the location and severity of your spinal ligament damage, well, we'll leave it up to you to decide what that means. At Spinal Kinetics, we are the medical radiologists that take your condition very seriously, and we are here to help. If you need help finding a doctor that can accurately diagnose your spinal ligament condition, please call us or look us up online. Thank you very much for your time.